So today I'm going to talk about chemotherapy. It's a very common question that patients ask us at the clinic. Also, there is a lot of anxiety amongst the patient regarding the subject. So hi everyone, I'm Dr. Amara Hassan. I'm an oncologist and here I am to help you to fight the fear of cancer and its treatment. I would like to give you a case example that we came across. Actually, the patient came to our OPD 1 year ago. She is a 50-year-old female and she came to us with a stage 3 breast cancer. We explained to her about all the details about her treatment, which comprised of chemotherapy upfront, followed by surgery, and followed by radiotherapy. We also explained to her the side effect of the treatment. That is, the side effect of chemotherapies, surgery, and its possible complications, and then radiotherapy. She was an educated woman, but somehow she got scared of the explanation that we gave her. She had a very bad experience regarding chemotherapy. She had a friend, some 52-year-old male, who died a year ago of colon cancer. As she told us, we actually don't know the staging of his disease, but what we could infer from the information that we got from her was that he suffered from a stage 4 disease, and chemotherapy was the only option for him. And after a few cycles, like 2-3 cycles of chemotherapy, the patient died after getting hospitalized in the hospital. So the patient inferred that that patient, that is her friend, he died of chemotherapy rather than the disease itself. The disease, however, was quite bad, and the patient wouldn't have survived for like a few months or so. Then this incident, it scared her so much that she deferred chemotherapy, and actually she denied any treatment for her disease, and she went to some other doctor for some alternative treatment, like maybe she was taking treatment at an Ayurvedic center or some equivalent. So then she returned to us a few months back, and now she has a stage 4 disease. So initially she had stage 3 disease, which was very curable. Now it is stage 4 disease, and just the chemotherapy that we can offer to her, a few palliative radiations for her pain control and all that. Other than, we cannot offer any survival advantage to her, any curative treatment to her. And what had been a curable journey for her now has become just a palliative treatment. That's it. So it's a very sad situation, and this video is basically about chemotherapy. So I'm trying to tell you people that chemotherapy is not something that to be very afraid of. Chemotherapy is like any other medicine. The only thing is that it's a little bit toxic and its side effects are a little harsher than the rest of the medicines that we use on the daily basis. So, however, it is an indispensable treatment modality for cancer. Okay, in almost all the cancers, we give chemotherapy, except for a few that I'll let you know later on. So, what are the types of chemotherapy? When do we prescribe chemotherapy? There are 3 kinds of chemotherapy that we just prescribe. In medical terms, we call it neoadjuvant, adjuvant, and concurrent. I'll explain you in a very easy manner. What is neoadjuvant chemotherapy? Let's see. Neoadjuvant chemotherapy is the chemotherapy that is given before surgery. Why we give this chemotherapy? Well, we want to shrink the tumor to such a size that surgery is feasible in that patient. Okay, suppose there is a big lump, we want to reduce that lump to a small size so that we can get a negative margin, that is a cancer-free tissue from that surgery. Okay, that is very important in the treatment. Also, to make the surgery easier, to resect a smaller size from the body. So the to say healing after surgery and getting recovered after the surgery, it's quite easier. So this is why neoadjuvant chemotherapy is given. Another type is adjuvant chemotherapy. So adjuvant chemotherapy is mostly used when we have already made the patient undergo surgery, and after that the patient comes with some residual disease on the surgical bed. That is, the tumor has been excised from that area, but that area has some microscopic or macroscopic disease left after the surgery. So why we give adjuvant chemotherapy? We want to kill that microscopic disease. I mean, we want to kill those cells that are still present at the surgical bed, that the surgeon could not remove. That's the purpose of adjuvant chemotherapy. The third type is concurrent chemotherapy. Concurrent chemotherapy is basically given with radiation. Okay, so why do we give concurrent chemotherapy with radiation? It is basically given to make the radiation work better. Okay, so suppose if the capability of radiation to control a disease is approximately 90%, adding a chemotherapy makes it 96 or 97%. Okay, so we get a better result when we add chemotherapy to radiation. So this is called concurrent chemotherapy. Coming to the side effects of chemotherapy. So the most common side effects of chemotherapy are nausea and vomiting, mucositis, that is having mouth ulcers, hair loss. It is very feared of side effect. People, uh, especially women, they are very concerned about their cosmesis, so they don't want to lose hair. So they come to us and they say that अरे chemotherapy होगी तो मेरे तो सारे बाल चले जाएंगे. I know it's psychologically very traumatizing, but it's unfortunately it is a side effect of chemotherapy, but it's not permanent. Okay, it's not that agar baal chale gaye then it will never come back. It's not so. It will come back after a few months. Another side effect is low blood count. So while giving chemotherapy, what happens is there is in medical terms we call it myelosuppression, and in layman term, if you want to understand, it is that decreasing the blood components, that is the RBC, red blood cells of blood, WBC, that is white blood cells, the platelet, these counts come down, they decrease. Suppose somebody has a hemoglobin of 11, so after chemotherapy it may drop down to like 10 or 9. Platelet may also drop down. The WBC count, which is very important for fighting disease, other diseases, that is it comprises our immune system, it also comes down. So however, this is manageable. The oncologist knows this and keeps an eye on this through your blood reports. Another common side effect is GI disturbance, that is diarrhea or constipation, or at times appetite loss, nausea, vomiting, I have mentioned. Then rashes or dermatological problems, skin problems. Okay. Another side effect is hypersensitivity. Some patients, while we start chemotherapy, they start shivering or start sweating or flushing, or their whole body gets covered with allergic reaction and all that. So we have to stop the chemotherapy at that time and we have to give anti-allergy to the patient. Okay. So these are the basic common side effects. But because of lack of knowledge of these side effects, because of wrong interpretation, because of misconception about a lot of things, people don't go for chemotherapy. They get afraid of it, and eventually, I just gave you an example what happened to that lady. We could have saved her, but unfortunately we could not. So now I'd like to tell you about the whole process, how this chemotherapy thing takes place. So chemotherapy is mostly given in the injectable form through IV lines, that is intravenous, and it is mixed with a fluid, usually normal saline or a dextrose solution, that is normal general saline solution that we have, all of us have seen. So it's mixed in that, and then it's given through IV line over a period of few hours. Okay. So the whole process is like this. First, your doctor prescribes you the drug along with the dosage and everything. The whole instruction is given in that prescription. This instruction is for the nurses, not for you. And along with that, he'll prescribe you a few tests, blood tests, basically the complete blood count and the serum urea and creatinine. Okay. So why does he need to do these blood tests? This is to establish your eligibility for the chemotherapy. Okay. So he wants to make sure that you have enough blood reserve to tolerate the chemotherapy, and also serum creatinine is to check your kidney function. Okay. So your kidneys are the organs that eliminates the drug from your body. So that's why complete blood count and serum creatinine test is done. Okay. So once you get these tests done, you bring those tests back to the doctor and he says that okay, fine, you're eligible for chemotherapy. So you book a date for your this current cycle of chemotherapy. Again, I would like to mention about the cycle of chemotherapy. So chemotherapies are given in cycles. Cycle means that you have you receive drug for over a few days, mostly a couple of days or 3 or 4 days, and after that you have a prolonged period of drug free time, drug free interval. Okay. So why this interval is given? It is given for you to recover from the injuries that chemotherapy does to your body. Okay. So as I have already mentioned, that chemotherapy makes the blood count go down, and also it has some adverse effect on your gastrointestinal or digestive tract, and it decreases your appetite and this and that. So this drug free interval gives you the time to recover from these side effects. Okay. So once you are recovered from this side effect, another cycle of chemotherapy is given to you. Okay. So yeah, so after receiving the prescription, you have to go to the daycare of the hospital and have to book your seat for a particular day for the particular cycle of chemotherapy. Once you have done that and get your blood test done and everything is fine, you're eligible for chemotherapy, you go to the daycare on that particular day, and then the nurses and the daycare in charge doctor, they'll do all the needful and then administer your chemotherapy. Okay. While receiving chemotherapy, you have to take care of yourself. Whether you are getting some reaction or not, you have to report to the doctor, on duty doctor there, or the nurses there, that you're feeling if you're feeling dizzy, or if your heart rate is going up, that is you're feeling palpitation, or if you're sweating, or feeling hot, or your skin is getting any rashes, that time you'll have to report those. These are the allergic reactions that are suspected in usually in the first cycle of chemotherapy. Okay. If everything goes fine and nothing happens to you, then it's okay, you have to continue with the chemotherapy. At the end of the day, when the chemotherapy is over, you'll have to stay there for a few hours. You are under observation. When the doctor and the nurse, they'll find that everything is fine with you, they'll discharge you. While you get discharged from the hospital or the daycare, you'll get a discharge summary. Okay. There are few sheets of paper in which the whole treatment and everything is written. Also in that discharge summary is written the medications that you need to take after getting back home to cope up with the side effects of chemotherapy. Also in that will be written the date for the next cycle of chemotherapy and the tests that need to be done for the next cycle of chemotherapy. Okay. Also in that discharge summary itself will be written the warning signs and symptoms of any emergency that happens to you. Also the number will be given, the number of emergency room of the hospital will be given in that discharge sheet, and the number of the doctor on duty will be given on that discharge sheet. Okay. So that if anything happens once you're home, or in a few days after chemotherapy, you can come back to the hospital, to the emergency room, and they'll attend you and whatever treatment is required, they'll give you. Okay, so this is the whole process of receiving chemotherapy. Chemotherapy is, as I told you earlier, it is an indispensable treatment modality for cancer. We cannot skip that. We'll have to undergo that treatment. So we should not be very afraid of that treatment, okay? As it is indispensable, we'll have to take it. There is no other option. Uh, so, so this is the information that I wanted to give you, people. If you have any other query regarding chemotherapy or something that you want to know specifically, you can post your question in the comment box. And if you haven't subscribed yet, kindly subscribe so that you get the notification for other videos that I'll be posting, and kindly share the knowledge. Thank you.